Good afternoon. Welcome to your Backcare class. Before we get started, we're going to talk a little bit about the SI joint, the sacroiliac joint, and I've got Fred here to show you. So the SI joint comes from sacrum, which is the 5 fused vertebrae of the low back, so down here, and the ilium, which is the hip. So it's where they come together right here. Now, if you were to feel your own SI joint, and I know some of you know where your SI joint is because you felt pain there before. If you put your hands like this, sort of first finger and thumb around the hips, and then just let the thumbs go downward, that's generally, you'll feel a little indentation. That's where your SI joint is, your sacroiliac joint is. Now, the sacroiliac joint, they come together, this piece of the ilium, this bone, along with the sacrum. They sort of fit together like puzzle pieces. So they're quite rough around them, but there's a lot of cartilage, so padding. But we can have issues in the SI joint where there's a little misalignment. And misalignment, not uncommon. It happens from a variety of things, hormonal changes, where we might have changes in our ligaments, or arthritis, where we might have some inflammation or wearing away of the cartilage. What we do for the SI, for the sacroiliac joint, when we've got issues with it, is we work on stabilizing the SI joint by increasing activity of the muscles that surround the SI joint. The other thing that we do then is work on a little bit of mobility through the lumbar spine. So that's what we'll focus on today. Yeah. And if you have any questions about the SI joint as I'm teaching, yeah, Marilyn's sharing. Oh, you want to see a picture?
No,
of it?
no, I'm going to. I'm going to another doctor. I want to look at this.
Oh, yeah, there you go. You look at it in great detail. The other thing, that is exactly where the issue is, the SI joint. The other thing, if you want some other images of the SI joint, I'm really happy to send them to you. I teach a module in our yoga therapy program on Backcare, and I've got lots of images for the SI joint. But right now, your very important work is to use that strap that you just spent, some of you, quite a bit of time getting a firm loop. And you're all going to get into a similar position as Pam over here on the left, which is simply a block between the knees and then a strap around the thighs. So you have your loop strap. We have successfully looped the strap in a way that it will not move. I'm saying this many times just to reinforce our success. And then what I'd like you to do with the strap is make it really snug. Now, how thick should your block be between your knees? It depends on your body. So the frame that I have is I have a pretty narrow frame. So I need my block to be about sort of medium width. This is narrow width. So if your thighs, yeah, don't have that much space between them, for sure you want to be on a smaller, a more narrow width. If your thighs have a lot more room than your medium or wide. So all I'm saying is you want that block to support you so that your feet could be sort of hip distance apart. Laura, you're just perfect. You're perfect. Yeah. Yeah. Yeah, you got it. That's perfect. And then all you're going to do, Burton, you're already there. Lie down. Just lie down, my friend. Yes, exactly. Knees bent, feet flat on the floor. So the strap is around your mid thigh. And then as you lie down, the idea is that your strap here is tight enough so that if you were to allow your knees to flop out to the side, they wouldn't, because you have the strap containing you. The block is there so that if you were to allow your knees to knock together so that they'd touch, they won't, because the block is there. Does that make sense? That's why those two things are there. So as you find that, just go ahead and lie down, get really comfy. You can place the hands wherever feels good for you, eyes can close. And then let's just begin our practice with full release of breath. So full breath in through nose. And then exhale, that's it, little sigh out the mouth. You've got it. Do that a couple of times. As you do, I'll start our music. Full breath through nose. Exhale out the mouth. Yeah, that's it. Good. One more breath just like that. Yes. Beautiful. Start now to invite your breath in and out of the nostrils. And as you breathe softly here in and out of the nostrils, find a little bit of space between lips and teeth. See if you might be able to invite in a small, really gentle smile to play on the corners of the lips. And then let's come into our full diaphragmatic breathing practice where we feel as we inhale, the belly rise, the ribs expand outward. As we exhale, we feel the belly draw in and ribs gather inward. So feeling on the inhale, that expansion, widening, opening, just like petals of a flower opening. On the exhale, that gentle return to center. That's it. Good. Come into your breath. Beautiful. So we take time always in our Backcare practice to start with this very purposeful, full diaphragmatic breathing so that we can calm the body. And in so much research, very high quality research, we've seen that this specific breathing pattern helps to reduce experiences of pain, specifically in low back and the neck. Good. We're also, as we're breathing like this, actually inviting in an actual massage to the area of the low back. So as we expand the ribs, we get a little massage in those muscles in the back. As we gather them in, it's another part of that massage. Good, that's it. Now, as you breathe like this, I invite you now to begin to set your samkalpa, your intention for practice today. To set your samkalpa, ask yourself this question: what quality would I like to invite into my practice today? What quality would I like to cultivate in this practice today? And today the answer might be around rest or healing, or maybe even around cultivating a sense of gratitude for what you have, or maybe self-compassion for something you're struggling through. Whatever answer for you begins to rise up or bubble up, begin to set that as your samkalpa, as your intention for practice today. So see that word or that phrase in your mind's eye. And now let's begin to invite in the feeling of that samkalpa, the feeling of that intention through the body. We can set our samkalpas together with the breath. Please first exhale, release out all the breath, just letting go. Good. And then inhale, draw that samkalpa through. Exhale, soft, gentle release out the mouth. Let it go. Good. Again, inhale, draw that samkalpa through. Exhale, little release to let go. Yeah, beautiful. One more breath, just like that. Yeah, beautiful. Good. Now, we'll start to move, but I'm going to stay with this position for a little while of knees bent, feet flat on the floor, still with the strap as it is, still with the block as it is. We're going to explore some SI joint stability movements. Now, here's the first one. Feel, if you can, draw your awareness to the block between your thighs. Lift up all your toes, release them all back down. And then with about 50% of your effort, so really important, please not all of your effort, about 50% of your effort, on your next exhale, squeeze the thighs together just a little bit. So 50% of effort. Try that again. Inhale. As you exhale, gently, gently squeezing the thighs into the block. You got it. One more like that. We inhale. And exhale, gentle, gentle squeeze of that. Good. You got it. Then lift those toes up. Release those toes down. Now we're going to do the opposite, which is pressing the thighs out into the strap on the exhale. So take an inhale. As you exhale, press the thighs out into the strap just a little bit. Try that again. Inhale, release the effort. On the exhale, press out into the strap. If you need to tighten it, go ahead. Good. One more like that. We inhale. And on the exhale, little pressing out into the strap. Good. Then lift up all the toes. Release all the toes back down. Have a little check-in with your body, and very likely one of those two movements, either the squeezing of the block or the pressing outward, would have felt more comfortable for you. If you really can't tell, you're just going to pick one. But if you noticed, oh yeah, it did really feel good to gently squeeze, you're going to do that 3 more times. If you notice, oh no, it did really feel good to press out, you're going to do that 3 more times. Go ahead, do that on your exhale. So taking a breath in, as you exhale, either squeezing in or pressing out. You got it? Again, inhale. Exhale, either squeeze in or press out. Good. One more like that. Yeah, beautiful. Good. Okay, excellent. Now what we're going to do is add on movements with the slow-mo ball. So see if you can reach for your slightly deflated, your slow-mo ball, keeping the strap, keeping the block, bring the feet maybe a little closer towards you, just so you can comfortably lift up the bum and then slide that slow-mo ball underneath. And then go ahead, adjust your feet if you need to change it again. Now we're going to work with our pelvic tilt. So as you inhale, low back arches, shoulders roll back. And then as you exhale, you're going to tuck that tail underneath. Now, as you're doing these movements, this pelvic tilt movement, you know well, keep going with your breath, inhaling, arching, exhaling, rounding. See if on the exhale, you can again focus on one of those two movements, either gently squeezing the block as you exhale, or gently pressing out into the strap as you exhale. Now, if you were one of those folks that felt, oh, both actually felt pretty good for me, then you can alternate. Maybe you do 3 breaths where you squeeze on the exhale, and then the next 3 breaths you press out on the exhale. Good. That's it. Good. And then we'll start our side to side movement. So moving the pelvis a little side to side, like we're drawing a little smiley face. As we inhale, hips move over to one side. Exhale back down through center. Inhale to the other side. And exhale down through center. Now, ideally, as you're moving, it's the hips moving, so the knees kind of stay fairly stable. Still, they're not moving too much. It's the hips themselves, the pelvis that moves from side to side here. Now, if it feels good, you can bring your arms a little out to the side, palms face up. I love to do that to get into my upper back a little bit more. And you might again see if it's comfortable for you. On that exhale, do either a little tiny squeeze of the block or a little pressing out into the strap. If it's a little too complicated to try and do that with a side to side movement, don't worry about it. The stability is happening even if you're not really proactively doing it. Now from here, we're going to roll the hips in a circle in one direction. So really feeling that pelvis roll around, draw a little circle. That's it. And then as you're ready, you can roll that little circle in the other direction. Good. That's it. Taking another breath or two, just another breath or two. Great. Yeah, excellent. Good. Now from here, we're going to come off our slow-mo ball just so we can take off the strap and the block. So press down through the heels, lift your bum up, remove the slow-mo ball. Come on down. And then as you're ready, you can bring those knees a little closer towards your chest. You can take the strap off, just place it to the side. We'll use it again later. Take the block out, place it to the side. We'll use it again later. And then stretch your body out long now. So heels press forward, legs lengthen. Arms reach up over your head. Big, big, long stretch. Let your whole body yawn here. You got it. And then let's do a side or lateral stretch. So upper body leans over to one side from the waist up to the fingers. If it feels okay, the legs follow too. So you're making a little banana-like shape with your body, full breath. Good. And then as you're ready, take a little walk back through center, and then you'll do the side. So the lateral stretch to the other side, upper body first, then adding in lower body. Maybe crisscrossing ankles only if that feels okay. And then as you're ready, go ahead, walk yourself back through center, interlace fingers now. Press palms up towards the ceiling or maybe the back wall. One more little press out through those heels. Good. You got it. And then as you exhale, undo the hands, arms come down beside you. Let's draw the knees in towards the chest now. So hands on kneecaps, starting to do our little massage for the low back. Drawing a little circle where half the circle is the inhale, the other half is the exhale. Now, as you do these circles, you might notice, oh yeah, this is really massaging, pressing into that area of the SI, the sacroiliac joint, pressing that into the mat. Go really slowly and gently and then switch directions. So after we do that stabilization work for the low back, then we can add in a little bit more mobility. Now we'll come into our hip circles, so hands on those kneecaps, separating the knees, pushing them away from the chest, away from each other. And then back in toward the chest and back toward each other. So nice big circles here. Yeah, beautiful, good. Beautiful, nice. Switching directions if you hadn't already. Great. And then as you feel ready, go ahead, reach up arms and legs, just shake it all out, shake it all out. Go ahead, draw those knees back in towards your chest, great. Now we're gonna do a little bit more stabilization work and then we'll go back to the slow-mo ball. Please place your feet flat on the floor and grab your thick block, please. Press down through the heels, lift your bum up and slide that block low setting underneath your bum. So the low setting, not high, underneath your bum. Notice as it comes underneath your bum that you might feel a little extra support that you can lean into in that low back SI joint area. And then I'd like you to imagine, as we had with the block between the thighs and the strap around the thighs, go ahead and lift up the toes as you inhale. Exhale, release them down. Imagine that you had that block between the thighs. Take an inhale. And as you exhale, gentle squeeze as if you had that block, but you don't. Good. Again, inhale, release the effort. On the exhale, as if you had that block. Yes, and one more. Good, that's it. Now we're gonna do the opposite. First, lift up all the toes. Exhale, release them back down. Now, without actually moving the knees, without actually moving the thighs, inhale. As you exhale, press as if you had a strap to press into. It's almost like pressing out through the heels, hey? Again, inhale. Exhale, gentle press out. It almost feels like you're pressing the heels away from you a bit. And one more. Good. You've got it. Yes. So this is stabilization for the low back, for that SI joint. Excellent. Good. Now, as you're ready, what I'd like you to do, please, is lift up your bum the tiniest bit up off the block. So press down into the heels. Feel like the shins press forward. Lift up the bum. So even some of the fabric of your bum is probably still on the block. But notice how that's effort for you to be in that little back bend. Take a breath. Good. And then what I'd like you to do is take the block out, lower your bum a tiny bit, but you're still in a back bend. So not resting it all the way down onto the floor. Good. Now, heel toe the feet just slightly closer towards each other, just slightly closer towards each other. Take a pause. We're going to continue our stabilization work. Keeping the left foot as it is, lift up onto the right tippy toes. So right heel lifts up. You might feel your body kind of lean over to the left, so try and bring yourself into center. Take a breath, and then lower the heel down. Left side, lifting up left heel. You might feel yourself lean to the right, so try and find center. Another breath, And then lower the heel down. Good. Now we're going to do right side again. Lift up the right heel. Pause there as you exhale. If it feels okay, leg lifts up. So if you can see my leg is lifted up towards the sky, taking a breath. And then as you exhale, knee bends, foot comes back down onto the ground. Left side, this is our last one. We start onto the tippy toes, take a pause, find center. From there, you can lift that left leg up. Take a breath. Good. And then on your next natural exhale, bend the knee, place the foot down, lower the bum all the way down, lower the bum all the way down. Great. Excellent. Beautiful. Okay. From here, I'm going to come into the slow-mo ball again, starting with windshield wiper knees to release. So reach for your slow-mo ball, lift up the bum once again, place that underneath. Heel toe your feet out really wide now. So as wide as your mat or even wider. And then let's start with those windshield wiper knees. So knees roll over to one side. Maybe the head leans to the opposite. Full breath. And then you inhale everything up through center and exhale to the other side. Yeah. Good. If it feels like too much with the slow-mo ball to do this, you can always remove it. Hey, it doesn't need to be there. We'll continue to do windshield wiper knees, but you now can decide what else do I want to add on. Maybe it's the basket arms. I reach the arms up, I crisscross forearms and bring that basket of arms over to the opposite side as the knees. Sometimes that's nice for getting a little deeper into the upper back, the thoracic spine. Or maybe there's another variation that you prefer to do here. Take your time. So here we're working with rotation or twisting of the spine. Moving gently. Yeah, beautiful. Good. And if you, like me, have your arms crisscrossed, just switch that crisscrossing so you can get into your opposite shoulder. A little different release. Good. Yes, you got it. Beautiful. Good. Yeah, lovely. Take another breath or two on the slow-mo ball. Good. Yeah, beautiful. And then what we're going to do, if you have your arms up like me, just bring them down. We're going to heel toe those feet closer towards each other. Lift up the bum, remove the slow-mo ball, come all the way down. Take a little pause. See what would feel good to you. Maybe knees in towards the chest, maybe just resting here for a moment. Now we're going to reach for our strap again. Now, the strap is looped. We're going to keep that loop because as you figured out, it's hard to make that loop. So we're not going to let go of it. Just pull on the long end so that you make the loop as tiny as possible. Does that make sense? Yeah. And then let's all agree the straps will always stay like this. And then go ahead and place the strap along the sole of your right foot. Slide the hands down the strap. Bend the knee a little bit as you guide the leg towards you, and then just start to point and flex so you can feel a little sensation of stretch in the back of the leg. So now we're getting into a little release for the hamstring, which is a group of 3 muscles in the back of the thigh. Maybe also into the calf. This can be so, so good for releasing the back. If you want to get a little deeper into the back of the leg, the hamstring, go into dorsiflexion of the foot, heel up, toes towards the face, and gently rock your leg a little towards you and a little away. That's it. Take another breath like that. Good. Now let's go for a position of stability for the hips. So thigh bone moves away from you till it's straight up and down or perpendicular to the floor. Tug down. Let's start that little circular action where you tug down on the strap and at the same time draw a little circle. Breath is nice and full here. Yeah, you can draw that circle in the other direction as well. Great. Yeah, beautiful. Now we'll lower and raise the leg so hands can slide down the strap a little bit. As you inhale, leg lowers. Exhale, do your shh to bring it back up. Go with your breath. We're going to do a number of these. Trying here with that shush breath to let the exhale be nice and long. Really feeling the work of the muscles of the abdomen contracting on the exhale. You got it. Yeah, beautiful. Let's do one or two more. One or two more. Good. Next time the leg comes up, keep it up. We'll go into a twist. Both sides of the strap go into the left hand, right leg crosses over. Two choices. Choice one, you keep the left foot on the ground. Choice two, you can shift your bottom over to the right and then roll over onto that left hip and knee, drawing the right leg a little closer towards the ground. So you're choosing what's right for you. Take time here to breathe and feel that opening in that thoracic spine, upper back. And then we can come into the hips a bit more and give a tug out through the heel, little counter tug on the strap to take a breath. And then if you like, you can rotate the whole thigh bone. So big toe side of the foot points down. Maybe even point those toes a little away from you, full breath. Yeah, great. As you're ready, slowly, gently guide your way back up through center. Let's switch sides. So left foot comes into the strap. Right foot down onto the ground, little bend of the knee as you start to guide the leg toward you and point and flex. So little release in the back of the leg. Good, nice, soft breath, soft jaw. If you want a little more sensation of stretch, finding that dorsiflexion of the foot, heel up, toes towards the face, and gently rock the leg a little towards you and a little away. Take another breath just like that. Good. And then we can again find that position of stability for the hip. Thigh bone moves away from you till it's straight up and down, perpendicular to the floor, tug down. And then start that little massage. So drawing the circle with the leg bone in one direction, full breath. And then in the other direction, nice full breath. Yeah, beautiful. And then we'll prepare to slowly lower and raise the leg, hand slide down the strap. Inhale, leg lowers, exhale, and do a shh, back up. Take your time with this, really allowing that shh, exhale to be long. See if you can actually feel the muscles of the abdomen start to contract a little bit, the ribs to gather. Simultaneously, the muscles of the pelvic floor are lifting up in support. Let's do one or two more. One or two more. Great. Next time the leg comes up, we'll keep it up. Both sides of the strap go into the right hand, left leg crosses over. Taking your choice, choice one, right foot stays on the ground. Choice two, scoot your bottom over to the left so you can roll over onto that right hip and knee. Taking time here to feel breath in the ribs to open up that thoracic spine, upper back area, full breath. And you can give a tug out through the heel, little counter tug back on the strap to take a breath. Beautiful. And then if you like, you can rotate the whole thigh bone. So big toe side of the foot points down, maybe even point those toes a little away from you, full breath. Yeah, beautiful. As you're ready, slowly and gently guide your way back up through center. Go ahead, take off the strap. Place it to the side, and then do what feels good for you. So maybe that's knees to chest, maybe it's windshield wiper knees, maybe something else. Great, good, yes. Now we're going to change our position. So from here, please take a little roll over to one side. Take a little pause there as you curl up into a little ball. And then as you feel ready, go ahead and push yourself up. And we're going to meet for our spinal waves. So you can meet with me on hands and knees, or if you prefer seated, of course, that's fine. Now, if wrists are feeling a little tender, don't put pressure on the wrists. You can always do forearms, maybe on your bolster, or fists, doesn't matter. Now we're working for mobility, movement in the spine. So let's start by rounding the back. Head drops down. There's your exhale. And then as you inhale, tailbone tilts out, shoulders roll back, gazes forward. That's it. Go with your breath. Exhaling as you round. And inhaling as you arch. Great. Yeah, good. That's it. So every time we do this movement, we're plumping up the spinal disc. I was speaking about that last week and earlier on this week. So good for any of us who experience sciatic nerve pain. Good. Now we can see what else would feel good from here. And many of you have your favorite movements you like to do. Here's one. You can bring those arms a little wider, fingertips off the mat, bum leans back. Do a little side to side, sort of like you're making that smiley face with your bottom, with your hips. Nice way to get into that thoracic spine. Yeah, another thing, if you want to work a little bit with flow and strength, you can come into a little flow here where you place the hands or the forearms on the mat. Lean your bum back on the exhale. And then as you inhale, come up through a plank, either keeping knees on the ground or tuck toes under to lift up. And then exhaling, coming on back into that child's pose. So this is just a suggestion if this is feeling not so good for your back. You absolutely don't need to do it. It's just if you're feeling like, yeah, this feels like a good way to support me to add on a little bit of extra strength. Now, however you are, we'll explore movement for maybe 3 more breaths. Just a little bit of time, finding a flow, a gentle way to be. Good. Yes, you've got it. And then I'd like us to start to meet in our child's pose, in our balasana, our child's pose. So you can choose either knees together or knees apart. Support your head in some way. So maybe the head naturally comes down, or you might grab your bolster or your block, or crisscross your forearms. If the knees are not feeling happy with child's pose, you do not need to be in child's pose. We'll be coming on down to our tummy next. You can always go there now. Now, however you are, let's take time with breath. So full breath in and full breath out. Good. Feel that movement of the ribs as you breathe in and out. So that massage you can offer yourself from the inside out with the breath. Great. Might even feel good to rock the head a little bit. Good. Excellent. Another breath or 2. Great. Now we're going to come on to our tummies for our back stability work now. So as you're ready, you can just bring any props off to the side. Come all the way down. I'll meet you down there. So we'll start with our arms crisscrossed. And your forehead can rest on the back of the hand. Unless you're unfamiliar with what we're doing, then lift your head up so you can see me. We'll start with our toe tucking, heel tugging. So we start first with the tops of the feet on the ground, toenails on the ground. And then with your right foot, you're going to tuck those toes under. As you inhale, tug the heel back. So kneecap lifts, front of the hip stretches. As you exhale, untuck. So you're back to the top of the foot onto the ground. Then from there, lift the leg. It does not need to be high. Exhale, lower the leg down. You got it. Left side, toes tuck under. Tug heel back as you inhale. Exhale, untuck top of the foot onto the ground. Inhale, left leg up. And exhale down. Good. Right side. Toes tuck under. Tug heel back as you inhale. Exhale, untuck top of the foot onto the ground. Inhale, leg up. And exhale down. Left side, last time, toes tuck under. Tug heel back as you inhale. Exhale, untuck top of the foot onto the ground. Inhale, leg up. And exhale down. You got it. Go ahead, turn your cheek to one side, bend the knees. Lower legs just sway from side to side. Great. We'll do our cobra movements next. So legs will stay on the ground, chest will lift. Bring those legs back down, tops of the feet onto the ground. Hands slide back, elbows bend. And then as you inhale, start to lift the chest up, gazes down. Exhale, lower yourself down. We're going to do 3. So again, inhale, start to lift up gently. Exhale, lower down. This time, let's hold. So we'll inhale up. On the exhale, come partway down and pause. Squeeze the elbows into the body, squeeze the elbows back. Take a breath. Come on to the fingertips. Take a breath. If it feels absolutely okay, arms lift up. Take a breath. Good. Let's come all the way down. Come all the way down. Crisscross forearms. Turn the cheek maybe to the other side. Knees bend. Lower legs sway from side to side. Great. So one of the other things that can really help support the SI sacroiliac joint is strength in the gluteus muscles, the buttock muscles. And one way to work with that is gentle extension or leg lifts. The one that we'll work with today is where we lift up one leg at a time. I'm just going to show you where we're going to go. Now, important that it's low. So if you can see me, I could go higher, but I'm not going to. I'm going to keep it really low. Leg is straight, really importantly. And then what I'm going to do is start to draw a box shape with my leg. We're going to do that together, okay? So you can keep your head down here if you like. Now lift up the right leg, keep it straight so the knee is not bent. Now as you inhale, right leg goes out to its own side, right side. Exhale, lower it down a little bit. Inhale, draw the leg into the midline. And then exhale, lift it up. You got it. Other side, inhale out to the side. Exhale, lower down. Inhale, right leg draws into the midline. And exhale up. Last time, same side. Inhale out. Exhale, lower down. Inhale, draw to the midline. And exhale up. That's it. Okay, lower the leg. That's a lot of work. Yes, for that glute. So let's release it. Bend the knees. Let the lower leg sway from side to side. So there's very few muscles that cross over the SI joint to support it, but there's muscles around it. The glutes are really important to support it. Let's bring those legs down. Left side as you're ready. You can change your crisscrossing if you want of your forearms. So left leg up. Keep it low, but leg is straight. Inhale out to its own side to the left. Exhale, lower down a little bit. Inhale, draw to the midline. Exhale, up. Inhale out to the side. Exhale, lower. Inhale, draw it in. And exhale up. Last time, inhale out to the side. Exhale, lower. Inhale, draw to the midline. Exhale up. You got it. Lower the leg. Turn the cheek, bend the knees. Lower leg sway from side to side. Beautiful work. Excellent. Good. Okay, let's stretch out our backs. So slide your hands back, push up through hands and knees, and choose either child's pose or downward facing dog. So you choose what you prefer. Child's pose or down dog. If neither of them really seem that good, you can go back to those spinal waves. Good. If you're in that down dog, sometimes walking the dog, bending one knee, pressing the opposite heel towards the ground feels really good. If you're in that child's pose, you might even like to walk your arms over to one side for a couple of breaths and over to the other. You choose. Good. However you are, take another breath or two. Yeah, beautiful. Good. Excellent. Okay. Now we're going to work on our other glutes now. Side line. So we have our gluteus maximus, back butt, and we strengthen that anytime the legs go up or behind us. And then we have the gluteus medius, side butt, and we strengthen that with our clamshell. So that's what we're going to do. I'd like you to find head support bolsters perfect for this. I'm going to use my Slimmer ball and my blanket. So you want to have some head support so that you can comfortably lie on your side. So bolster is great for that, but you can use something else if you prefer. And then go ahead and stack your knees. So bring your knees pretty close and towards your chest. So take your hand on your top hip, the side hip, side butt. This is what we're going to strengthen here. As you're ready, keeping the sides of the feet together, inhale, lift up that top knee. And then exhale, lower it down. That's it. Just go with your breath. So as you inhale, you lift it up. Keep it nice and low. Exhale down. A couple more. Inhaling up. You can feel the muscle contract. Exhale down. Two more. Inhale up. Exhale down. That's it. One more. Good. Okay, now we're going to do the opposite action, which is that we keep the knees together, but the lower leg lifts. If that doesn't make sense, have a little look at me. As you inhale, you're going to lift up the lower leg, and then exhale, lower it down. So inhale, lifting up the foot, the low leg, exhale down. Two more times. Good, you got it. And one more. Good. Okay, now we are not done with this hip yet. We're going to keep going. Straighten out that top leg, let it hang out in midair. As you inhale, leg lifts up a little bit. Exhale down. Same thing. You can feel that top hip and notice, oh, yes, it is working. You can feel those muscles contract. Whenever this gets more stronger, it takes pressure off the low back. Now let's work on rotation. So as you inhale, toes come up, leg comes up. Exhale, toes down, leg down. We're doing 3. So we inhale up. Exhale, toes down. Last one, inhale up. You got it. And then exhale down. Good. Please stack your knees, take a pause. That side hip has worked. You will probably feel sore here. That is okay. Let's release it. We can do our sideline dancer pose where we back the leg up. Either press on the front of the thigh, or if it feels okay on the knee, you can reach back for the top of the foot. So it really sort of depends. This is also an opportunity for you to make use of that beautiful loop that you had before. You can take that loop around the sole of the foot and the strap. Take another breath in and out, however you are. Yeah, perfect. Good. Okay. Now, if you have hold of the foot, just slowly release that. Stack the knees and flip on over to your other side. Great. Bless you. Okay, so as you come on to this side, you're going to stack your lovely knees once again. Bring your knees pretty close in towards your chest. We're going to start with our clamshell. So top hand on top hip, just so you can feel the muscle group working. Inhaling up and exhaling down. We do about 5 of these. Important as we're working that we want the knee to be really low as it comes up. Why is that? If the hips do not remain stacked evenly on each other, then we're not effectively getting into that muscle group. Okay, lower the knee. Opposite, now keeping the knees together. That lower leg lifts, and then we lower it down. If you're unsure, you can have a little look at me. So the feet separate for the leg to lift, and then we lower it down. So knees together, the foot lifts up. Good. Let's do one more. Yeah, beautiful. Okay, now straighten that top leg. Let it hang out in midair. As you're ready, lifting up. Exhale, lowering down. We're doing 3. Inhale up. Exhale down. Last one, inhale up. And exhale down. Now rotation. So toes up, knee up, leg up. Toes down, knee down, leg down. Inhaling, rotating up. Exhaling, rotating down. Last one. Good. Okay, give your beautiful hips a break. Stack your knees, take a breath. You can then come into your sideline dancer pose where you back the thigh bone up. Either press on the front of the thigh or reach back for the foot or use your strap to loop around the back of the foot. Take another breath in and out. Relax the shoulders, however you are. Feel a little, good. If you have hold of your foot, undo that hold, stack the knees. Beautiful. Good. Excellent. Okay, now from here, we are going to release back onto our back. If you want to have a sip of water on the way down, that's a great idea if you've got some water nearby. If you've got socks that you normally like to have on and you would take them off, you can put them on. We're going to be lying down for the rest of the class, or you just lie down. You do what you want. Yeah. So after all of that hip strengthening work, important that we do some hip release work. So we're going to come right into our massage. So massage balls, 2 massage balls of equal size. If you haven't got those, you let me know and I'm happy to bring a second one for you, Diane. Yeah, maybe? Yeah. Spiky balls are great. Have you got them over there, Jim? Okay. Good, good. Did I miss anyone who needs a second ball? Okay. So we're going to place them underneath, yes, underneath your side hips. Good. So you're going to lift up your bum and then just place them underneath each hip. Now, really normal, because we've just done a whole bunch of hip strengthening work. So you can use those spiky balls for sure. Diane, if that's too much for you, let me know. And then as you get there, just start to roll the hips a little from side to side. Yeah. Now I've got little softer pink balls today and they're moving around quite a bit. So I'm gonna also move them in. You can move your massage balls a little up or down or a little in towards your midline a bit more. You do what you want here. Yeah. Now we're going to go a little deeper into our hip massage, coming into our figure four, crossing one ankle over the opposite knee. And then if it feels okay, you can rock over to that side a little bit. So what I mean by that is I have my right ankle crossed over the left knee, just rocking over to my right side and back. Now, for some of us, as we do that, we'll go, oh, wow, that's a lot. You can move your massage ball a little up or down or a little in or out. If you can find that same fulsome breath that you started with, and if you find the breath is halted or not so easy to come into, it might be that you're getting too much sensation. You just need to move the massage ball a little bit. If you want to combine this with another release, say for the back of the leg, for the hamstring, lift the leg up towards the sky. Bring the leg a little out to its own side. And then we're going to rotate the leg here. So heel in, toes out. And then bring the leg in a little bit of a circle. So it both gets into the outer hip muscle and gets into those hamstrings, those group of three muscles that grow out of the sitting bones, the base of the pelvis, and attach to the back of the knee. If it feels better to do this with the knee bent, for sure you can bend the knee as you do this. Good. Really monitoring your breath. If it's stopped or halted, you're moving the massage ball so you feel a bit more comfort. Great. Yeah. You got it. And then let's switch sides. So I'm bringing my right foot down, crossing left ankle over, rocking over into it. So although we've been focusing on the SI or sacroiliac joint today, it's really possible that you might also have a very tight piriformis muscle, which is the side hip muscle. You might even also have sciatic nerve pain. This type of release, so good for releasing that. I'm doing my little rock to the side and then perhaps adding on a slightly different movement. I might bring the leg up, maybe out to its own side. I might even work with that rotation where the heel turns in, the toes turn out, and I rock around. So I'm rolling a little circle. You can do that either with the leg straight or bent. Yeah, wonderful. Good. Take another couple of breaths. Yeah, beautiful. Good. Now, as you're ready, you can bring the foot back down if it's lifted up. You can remove those massage balls. Just take a little moment to pause and see how that is. Okay. Now, if today you'd like to get into the shoulders a little bit more, option now to take those massage balls to the top of the back. Now, if the massage balls are a little too much, and sometimes they are, you can instead use that slow-mo ball or back mitra. This would be a time to try that out if you wanted, Sally. You can put the slow-mo ball between the shoulder blades. So I'm giving you really a couple of options, perhaps massage balls, perhaps slow-mo ball, perhaps if you have it, the back mitra, the foam strip. If you feel like that was too many options and now you don't know what to do, let me know. I'm very happy to help out. So we're just looking for some sort of feedback in the upper back. Start with your breath, that full diaphragmatic breathing, and then start to add on some arm movements. So one that I love is fingertips together. This, Burton, is good for memory, it is said. I know you were trying to remember what you were going to buy at the store later. So fingertips together, elbows bent. As you inhale, arms lift up over your head, and exhale, hands back to the heart. This is, in fact, meant to be good for memory. Yes. I know we all need it, right? Good. Yeah. Good. Does it feel okay in there? Great. Beautiful. Other movements that might feel good is arms out to the side. You might try that. Arms float out to the side and then back. Yeah. And up to you what you do with your legs. Sometimes it's good to have them bent. Sometimes better to have them straight. If you want to get into the hips a bit, you can also try a crossing of the ankles, kind of like you're in cross-legged. Here's what I mean by that, like this. So we're just taking time now with the shoulders to find our release. There's another movement that you know you really love to do. Please, please guide yourself through that. Great, yeah. Really taking this time for self-massage, this self-care. Yeah, good. Beautiful. So you're welcome to do this for as long as feels good for you. What I'm going to be doing for my in-studio friends here is starting to make my little walk around to help with chairs for anybody who would like to have legs on a chair. Now, if it's feeling today like, oh, I really want to actually work with opening my upper back a little bit more, you might prefer to rest in heart bed pose where you have the chest lifted. Do you know what I mean? Yeah, where you prop it up a little bit. I see you. Good. Cheryl, are you ready, my friend? Oh no. Oh, I'll come. It's okay. I'll come back. I'll come back. Good. Here you go, Jocelyn. You're welcome. Good. Other options for Shavasana, lying on your back with a little bolster underneath the knees. Sometimes that's nice. There you go. So it truly doesn't matter what you choose. The most important thing, I'll grab you a chair, is that you're comfortable and you feel supported. You're right here. There we go. Okay. I'm just taking a little look around. Anybody who'd like a chair, you just call me over. Good. So it's possible in this moment, it feels like, oh yeah, I'm really ready for stillness and to relax and close my eyes. Or it might be that massage feels really good to continue for a little while and movement. Either is fine. It's important that you know you do not need to be in stillness if that doesn't feel right for you. That's just fine. But let's find our breath. So full breath in through nose and then full exhale out the mouth. That's it. Try that a couple of times. Full breath in and full breath out. And then start to feel breath come in through the nostrils as you inhale and breath flow out the nostrils as you exhale. So finding that rhythm of your full diaphragmatic breathing. And one thing we've been working with a little in class the last couple of weeks is working with a count of breath, which sometimes can help to increase calm and to give your mind a little something to focus on. With the count of breath, we encourage the exhale to be just a little longer. So we're going to lead you through a count of breath as a count of 4 on the inhale. We'll do a little pause and then a count of 6 on the exhale. Now, if that pacing doesn't work for you, just ignore my voice and just breathe as feels good for you. If you want to join me, start first with an exhale. Release out all your breath, letting go. Good. And then inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Last one. Inhale, 2, 3, 4. Pause. Exhale, 2, 3, 4, 5, 6. Just find full breath in now and full breath out. Really feel that full capacity of breath that you've worked on. And then as it feels right for you, start to invite in some movement. You can wiggle through fingers or toes, let the head, the neck roll a little from side to side. Starting to invite in some soft, gentle movements. For those of you who have a chair and a bolster, I'm going to make my way around to remove those for you. Take your time adding in movement that feels good in your own timing. It might feel good to gradually come to a place where you stretch or reach the arms up over the head, maybe with a big sort of yawn. You might take a bit of time to find a movement we did earlier in class that felt really good for you, or maybe something new. Good. And then let's take our time to transition. Take a little roll over to one side, a little pause there. And as you feel ready, go ahead and push yourself up to a comfortable seat. Invitation here to guide the hands to the heart for the eyes to softly close. We can close our practice with 3 shared breaths. So first exhaling, releasing the breath to let go. And then inhale, breathe deep into the space of the heart. Exhale, soft sigh out the mouth. Again, inhale into the heart. Exhale, little sigh out the mouth. And one more breath, just like that. You softly bow your head over your fingertips. Here, symbolically releasing the thoughts of the mind into the space of the heart. So infusing all thoughts with the qualities of the heart: love, compassion, and forgiveness. Take another breath, lifting the heart to the mind. And then as you exhale, slowly peel open the eyes, softly lift your gaze. Thank you so much for sharing your practice today. Thank you. Mm. Mhm.